Next slide, please. So we have the three main functions. You can find them on the start screen. We will start with the guideline section. And when you click on it, you will have the repository of guidelines developed or endorsed by ERKNet. And this guideline section is designed to have flexible access. So you can either read the full text manuscript categorized in chapters for a comprehensive read. You will have a glossary of terms and abbreviations and the references. Once you click on it, it will be pop up at the bottom of the screen. You will also have the access to shortcuts to the recommendations, to the key recommendations, including the evidence when available. And you will also have a link to decision pathways if there is one available. You have personal note functions and bookmarks. So far, we have included 16 guidelines developed or endorsed by ERKNet, and we are about to publish the 10th guideline in a few days. We just need to finalize some technical things. The next feature is decision pathways. So we have included them to navigate and help clinicians through different clinical scenarios, either the diagnosis or for the treatment. And when you click on it, you will be guided in a step-by-step decision-making process to enter the clinical status or parameters for the patient, and it will help you evaluating the condition or treatment options. So far, we have 7 decision pathways. They were either transformed from available algorithms from the published guidelines, or we have also developed new decision pathways within our working groups. The next is that we have some clinical test calculators implemented, which are, I think, very useful for clinicians or patients involved in nephrology, and it will allow you to quickly and accurate calculate kidney test function without having many external sources. So far, we have 11 calculators in total, but if you have other ideas or suggestions, please just let us know, and we will keep them on our desk to implement them. And as a last, I also want to highlight, because maybe you don't know, you have also the opportunity to access the Guideline app on your browser desktop if it's more convenient for you. So you can also check all the information on your desktop. The structure and all the functionalities are similar to those in the smartphone app, and all your bookmarks and personal notes will be synchronized. Yeah, so if you want to access the web application, you need to go to the website, and the identification number can be found under the settings in your mobile phone app. But everything is also written down in the detailed guidance document, which can be found on the ERKNet website. So, and the next is, I want to ask you to join our Mentimeter, and I hope that many of you have already experienced the app. So let me share my screen. So I hope you can see which screen. Can somebody confirm that they see? Yeah? Okay. So I hope maybe I give a little time until everyone can join.
Maybe you can press the thumb up button when you've joined the
Maybe
Menti.
press the thumb up button that I see that you are here, because I cannot see how many. Okay, we have 3. Or maybe if you haven't used the app at all, maybe you can just make a note in the chat box that you haven't used it or you are about to download it. Okay, just downloaded the app. Okay, thanks, Marianne. Still haven't used it, just downloaded. Okay, so then maybe it's Pedro, of course, I downloaded but didn't play enough with it. Okay, so then it's a good opportunity to download the app and to start experiencing now in the next days, and maybe, yeah, probably we will redo the feedback session during the annual meeting. So, but yeah, let's maybe start with the first question, which is, what is your professional background? So we are interested in who is using the app. Is it more senior experts, or is it more useful for clinician in trainings? So maybe if you haven't downloaded the app yet, please also give your voice here so that I can see what is your interest. So, it's very nice. We have 4 patients.
Yeah, and Flavia also said it can be useful for patients,
Yeah.
especially the calculator functions.
Yeah. Senior experts also. So it's also good to see that for the experienced clinicians, it's also helpful or probably helpful. Okay. So then maybe we just go to the next one. How would you rate the overall experience? So I'm happy that no one says poor. Very good, good, average. So if you don't want to raise your voice here, you can also write an email to me what you think is not so good or which parts can be improved. But I'm very happy that most of you think it's very good. Then maybe we'll go to the next one. How would you rate several aspects of the app? Relevance of content, yeah, I'm very happy that you think it's useful. Interface design, also in the upper part, ease of navigation, loading speed, yeah. I know sometimes because we have changed the settings, it will not be an automated download of all guidelines, but once it's downloaded, the first time it needs some time because also depending on the size of the information, but once it's downloaded, it will go faster. Okay, let's move forward. Which features do you find most useful? The recommendations, then the calculators, decision pathway. Yeah, we have also the possibility to have some analysis tool from our developer, and there the calculators and decision pathways are really the top features which are used. Yeah, so this mainly reflects the analysis of the usage. Thank you very much. So now you will have the opportunity to write what you wish to have, which functionalities, which calculators. So feel free to say something, but all great is good. More guidelines and calculators, yeah, of course. So now we have the DENT coming up. We are currently preparing the IPNA SSNS guideline, and yeah, the KDIGO is published, so many guidelines will come up, important also for non-ERKNet members. Yeah, we have many downloads also, yeah, globally, so I think it will be also of use for non-experienced or yeah centers. Link to learning criteria, correct. Link to learning societies, kidney prediction tool, patient material. Yeah, maybe in the chat box someone can write to me who told this, so we can talk about this more in detail, or write me an email.
Tanja, Flavia also
yeah.
asked, yeah, do you see that?
What's the time frame? You mean how long it takes to upload or integrate a new guideline? Yeah, okay. So yeah, I have a student assistant who helps me with the editorial system to transfer all the information to the system. Yeah, it depends on the size of the guideline. So we can be very fast, so it can be done within a week if it's not a huge document. Yeah, the problem is that we have to re-modify all the pictures or the figures and the tables which are in the guidelines. So our developer, with whom we collaborate, they need to make new figures which fit to the app design and the features. So this takes a bit, but he's also quite fast. So yeah. And if there is a pathway in it, we need to have some more days to have this pathway integrated, and then it needs to be linked. But it doesn't take months. So the then guideline was published end of January, and I think next week we can have it published. So yeah. Yeah. Okay. So next one. How likely are you continue using the app in your clinic? You think it's very practical or somewhat, but you need still other sources or will consider other sources. Neutral if you are not sure about long-term sustainability, and unlikely that it has no impact for your clinical work. Okay, very likely. That's very good to hear. So, okay, 6 answers. Okay, so I think majority is happy with the app, and I'm happy that most of you or some of you will now consider downloading the app, test the app, and then I can get more feedback during our annual meeting. Yeah, that's it. So thank you very much from my side. And if you have no other questions in the chat box, I would give the word to Vanessa.
Thank you, Tanja. I'm going to share my screen again. Give me a quick feedback. Do you see my screen?
Yeah.
Good. All right, then. I'm going to continue with the second topic, which is the center activity monitoring system. And I will give you a brief overview about over the results of 2024 and the past years. So the comms has been implemented by the ERKNet network as one of the first ERNs, and it defines as a center activity monitoring system, which is for evaluation and tracking of the central contributions to the ERKNet's core activities, which I will show you later on. The good thing about it is that the centers, the HCPs, don't need to provide any data from themselves, so we can all retrieve the data from our database, and we can all like sum them up and have an overview over all the activities they do. And therefore it enables the objective benchmarking and comparisons of activities. We collect the points or the activities itself over a 3-year period. So that means the results of 2024 are a sum of the past 3 years, so not only the last year. And it is an annual reporting system which is implemented and helps us to gather all the activities. So here you can see an overview over all the activity areas where the centers can collect points. And as you can see, there are quite various, so they have different options to gain points, and The first one is, for example, the registry, where they can enroll patients and upload patient data or enter patient data and update it. So they can earn up to 25 points for that. The second area is the education area, where the centers can provide e-learning cases, and either as an author or as a reviewer. And they can as well take part in webinars, either as a speaker or a moderator. And they can as well provide or motivate people to take part in Stefanie's curriculum as a student, which is also gaining points. The third part is guideline development, so they can take part as a guideline leadership or in a guideline membership, and as well they can gather points like through work group participation or task force participation, and as well in taking part in the ERKReg board as a co-chair or a member. Last but not least, they can as well provide any panels. That means like they can enroll patient data to ask experts for a contribution. They can either submit a case or they can review a case. So both both does earn points. These are the current activity areas, but there are more in the future. Just for you to have an overview, and here you can see this is the overview over 2024, how the ERKNet centers have how many points they have collected in the past 3 years, and it's you can see all the different areas. So the orange one is a registry, the green one the education, and so on. And you can see they have different like areas where they're stronger and some areas where they're a bit weaker. But unfortunately, we have as well some centers who have not gained any points. But yeah, that's like just for you an overall sum up. Because we want to motivate centers to enhance their center activity, we have thought about new areas, how they can really engage themselves and yeah, provide more activity and like really yeah, have a say and have a participation in different activities. So for example, we said they could as well develop disease brochures and do proofreading, and they could as well take part in app decision tree development as a leader or member. And which like what is as well really important, what could be a good option is like the participation in a sub-registry, because we have so many now, and as well the registry analysis projects where they could provide their expertise and the time, and there would be the opportunity to do as well research surveys. And the last point is the clinical care performances, but this is like in the future maybe possible. What we would like to support, like how we would support the centers, is especially for the low scoring centers, provide them with individual online meetings, to give them an opportunity to show that they really want to take part in the centers and the ERKNet's activities, because this is why they as well have a part in the network, because we would like to have all the centers together, like be active. And we would like to discuss possible activity options with them, with the centers who are as well really interested in enhancing their activity. And we would, before that, maybe like do a little revision of reasons for low activity scores. And we have, of course, already supportive ERKNet material available. So there are options, definitely. And our aim, as I said, is enhancing the center activity in the ERKNet network for everyone. So if you've got questions, send us an email. We are happy to answer them. Any questions so far? In the chat, can you see them?
No questions in the chat,
Okay.
but if someone wants to raise their hand and speak up, you're welcome.
If not, I would just continue with the next one.
Yeah.
So our ERKNet clinical exchange program has launched last year in June. I don't know, maybe some of you have heard of it. It is especially for junior healthcare professionals and allied healthcare professionals, as you can read here, and especially for them who are interested in rare kidney diseases. The eligibility as well includes that they should be employed in one of the ERKNet member centers or affiliated partner centers, and they should not participate in any other ERN exchange program, because we want to give everyone like an opportunity to take part in such an exchange fellowship, and especially the young professionals don't have so many opportunities. One of the main things, what we think is as well really important, is that they should not live there where they want to do the exchange. So it's like cross-national, so not in one country. So if they live in Germany, they should not do the exchange in Germany, but in another country. Yeah, the first call was in June 2024, and we would like to do 2 calls per year. We have received 27 applications in the first call and have organized 5 exchanges, of which we have already done, I think, 3 now. So still 2 ongoing. And yeah, so these exchanges will be in 9 HCPs from 6 EU countries, or I would say they're all part of it. The exchanges are in the different HCPs and in 6 countries. Yeah, the next open call will be this year. So first of all, I would like to motivate the host centers, all the ERKNet centers who have not yet said that they would be willing to take part, that they just think about if they could host an ERKNet clinical exchange fellow. It would be really nice, because I think they all do as well profit as from this program. And you can provide feedback until the 17th of February. I have sent out emails to all the centers who have not yet taken part in that exchange. So feel free to send me an email if you have got questions to that. And last but not least, we will open our second call on the 19th of February for the applications. So for the fellows who really want to take part in that clinical exchange. Yeah, that's, I think, from my side. And now to Stefanie.
Yeah. Questions to the exchange program? If not, then I give you a little update on the ERKNet postgraduate curriculum. You probably have heard all about this curriculum, but just for new colleagues as a reminder. So the postgraduate curriculum was launched 2021, and it consists of 3 different parts. One are the webinars. So we have over 3 years webinar schedule every 2 weeks. Including exams, and it will cover all 56 topics, including pediatric and adult topics. Students who are enrolled in the curriculum have to attend at least 48 webinars and achieve a cumulative score in the exams of more than 75%. And then additionally to that, we also have the e-learning cases, which are like presented as a basic or advanced scenario where students can go through typical rare kidney disease cases and solve them accordingly. Also here, at least 30 cases have to be processed over 3 years. The next is the clinical experience. So students also should be employed in an ERKNet center or affiliated partner site where they work for at least 2 years in the field of rare kidney diseases, and it has also to be stated with a letter of or statement letter of the supervisor. The next slide. Vanessa, I have a lot of animation, so you have to do a lot of tapping. So the curriculum was launched, as I mentioned, 2021, and we would like to start every year a new class. We have already 5 classes running with a total of 465 students. And as you can see in this little graph, in the first year, we had amazing number of more than 230 students which enrolled for this curriculum. But after that, we have still a steady number of roughly 50 students per year. Next. Yes. So overall, you can do one more. Overall, the student, now back. Overall, the students come from 68 ERKNet centers, which is nice because we have 72 centers. So it almost from each center, someone is participating. And the students are from 21 EU countries, as you can see in the map on the right-hand side. And as you can see, there are 50% from adult and 50% from pediatric units. You can also see that this curriculum is very well taken up by clinicians in training with 51%, but also junior and senior experts are using this program to gain more expertise in the field of rare kidney disease. And we have also geneticists and nephropathologists participating. And so, yeah, you can also tell this to your colleagues in the geneticist lab or nephropathology lab that they can also apply for next time. Next slide. Now I would like to go for the graduates, because we have already 2 complete classes. So 2023, the first class completed with 65 graduates. These were 28% of all students. And this year, or in the end of last year, another 13 of the second class completed the 3-year program, which represented 24% of all students of that cohort. You can see we are also having certificates for the graduates, which look like in the picture below, and we are now also creating the certificates for the second class of graduates, and they can then call themselves European Rare Kidney Disease Specialists. Exactly. And just to give you an idea from where the graduates are coming from, so they're also spread over Europe. They are from 35 ERKNet centers and coming from 21 EU countries. Next slide. And one more. So far, we have offered 125 webinars since 2018, and we are collaborating with pediatric and adult nephrology societies like the ERA and the ESPN, but also with other ERNs like MedHub-ERN, Eurogen, Ithaca, and so on. In our webinars, which are for free, we have attendees from all over the globe. And yeah, like usually 50% of the attendees are from ERKNet centers and 50% are from non-ERKNet sites. And overall, more pediatricians are following us than adult nephrologists, but this depends, of course, also on the topic. The next slide. So where can you find our webinars? They are displayed on our website, on the part of education and training. Here you can register for the webinars, but you find also a huge repertoire from all of our webinars in our YouTube channel, which is called ERKucation. I don't know if you have seen this already, but it's also linked on our website, and then you can see all of the webinars which have already taken place. Next slide. Additional to the webinars, we are also producing these e-learning cases, which I have already talked about. They represent basic and advanced scenarios, and so far we have 32 e-learning cases available and more in production, and they are generated by our ERKNet senior experts. The aim of the e-learning cases is to establish and diagnose rare kidney diseases and also select appropriate therapeutic strategies. Next slide. And this is how one of these e-learning cases looks like. So you can see there are different levels where a student has to go through and answer questions depending on the case. And so far, this is only available for our curriculum students. Next slide. The e-learning cases are available on our Moodle platform, which are set up for our curriculum students. And you can see here that we cover all different topics of our curriculum, the different disease aspects. And we have so far, as I already said, 32 e-learning cases available. And you can see that we have 7 cases from the glomerulopathies group, 6 cases from the AD structural disorder group, same from metabolic and so on. And we are working also in the working groups to raise the numbers also for the working groups, which are not presented yet. Next slide. And we also did some updates on the students platform, and this is a platform which is integrated in our website, which is only accessible for postgraduate curriculum students. Here they can oversee their performance. One more, 2 more, yeah, 1 more. As you see on the left side, here is an overview about the webinars. So you see all of the webinars you have attended. You also see directly the exams linked to the webinar. And there's also the possibility to repeat an exam in case you are not satisfied with the scoring. And now we have, as you can see, also implemented a more easy overview to see what has already been performed and how much still needs to be done in the 3 years. There are also the webinars linked, which have not attended yet. So this is also an easy way for students to not miss any important information. And on the right-hand side, this is a new feature, and maybe some students have already discovered that. We have now also the ERKNet e-learning cases available on the same platform, where you can see all of the achievements, and you can also here request repetitions if necessary. So this was my, next slide. This was my presentation. Of course, I will want to thank again always our moderators who are doing a lot of work, like moderating each of our webinar sessions. But I also would like all webinar speakers, e-learning case authors and reviewers, but also our team, Hannah, Matthias, and Eyal, who are helping me in setting up all of the content management system, the reports, the certificates, and helping me a lot with the administration. So thank you very much.
Hi. We recently launched the IJ subregistry. We wanted to give a brief update and also talk about the user day that we're going to hold next month. So can we move to the next slide? So as you all know, in ERKNet, we have ERKReg, which is the registry for patients, and we have the core registry, and then you also have specific sub-registries for certain diseases, and IgA vasculitis and nephropathy is one of them. You also have new sub-registries planned, as you can see in this slide. So the steering committee of this IgA nephropathy and vasculitis registry is composed of Dr. Alicia Peruzzi and Dr. Jürgen Flügge. And since the last time that I gave an overview about the sub-registry, we now also have an external advisory board with Dr. Manuel Praga, Dr. Sigrid Lundberg, and Dr. Tim Ulinski. And this is I evaluated the data 2 days ago. So overall in ERKReg, we have about almost 28,000 patients, about 10,500 patients with glomerulopathies. IgA nephropathy is about 16% of which the majority are biopsy confirmed, and 8% of the IgA nephropathy patients have already been enrolled, which is 121. IgA vasculitis is a bit more. We have about 16% of all IgA vasculitis patients enrolled in the sub-registry. So this is the patient enrollment over time. This is not specific to the sub-registry. We can see, so 2025 has just begun, so we assume it will be more patients as the year progresses, but we can see that overall we have a steady rate, a steady increase in the number of patients with glomerulopathies, IgA nephropathy, and vasculitis. It is quite linear. We hope to make it, we hope to enlist more patients this year, but overall it's a very nice curve that's consistent. When we look at the sub-registry, the next slide, we can see that, sorry, one more. Yeah, so we can see that we launched the sub-registry in October of last year, and we had a steep in the number of patients. The numbers before is during the earlier phases, which would, when it was limited for us and another setting just for testing, but since then it's been increasing quite nicely, and we hope to continue that trend. Can you move to the next slide? So this is by centers, and we can see that the majority of centers currently contribute are from Italy. And we hope to enlist more and more centers to this new sub-registry. Can you move to the next slide? So just to remind, what are the inclusion criteria for the sub-registry? So for IgA nephropathy, we're looking for at least one clinical criterion, which is episodic gross hematuria, persistent microhematuria, and progressive kidney function impairment, and histopathology, basically evidence of dominant or codominant IgA deposition. So you need both. And for the vasculitis, we're looking for palpable purpura and clinical histopathological criteria, which could either be a clinical or histopathological. But in any case, kidney involvement is mandatory in order to be added into this sub-registry. So, how to add the patient to the sub-registry? That's actually quite easy. When you go to the basic data of the patients in the sub-registry, you have the option to select IgA nephropathy and IgA vasculitis sub-registry. And once you do that, you have more fields specific to that sub-registry. That's also true for other sub-registries. But It's very important to know how to do that. This QR link here on the right is for a user feedback survey that we're looking for improvements. So if you have used or are going to use the subregistry, please give us some feedback so we know how to improve it, so it's easier for you as well. And if there are some things that are not very well understood or require clarification, that's also important for us to know, so we can make the best of the subregistry. And I think this is the most important part. So on March 5th, in the afternoon between 2 to 4:30, we will hold a user day. The QR link is for the subregistry registration. We ask you to register in advance so we know how many people are going to attend it. It's only virtual, and the idea of this user day is to provide training and specification on the IJ subregistry, and also discuss the user feedback that we summoned so far and hope to summon until the subregistry user day. So we hope that you use the subregistry until then, so it would be more beneficial and we could address specific topics that arise. And we will also discuss how to become an ERKReg center to contribute data if that's relevant for non-ERKReg, and also ERKNet centers. Thank you.
So I guess it's our turn, right?
Yeah.
Unless there are
wait,
any questions.
Are there any questions
Yeah.
to Eyal's topic? No? Okay. Yeah, next point is
one thing, I'll put the link also in the chat for the user day.
yes. So our seventh topic of the agenda is a new project. We recently started this project in the scope of ERDERA, and we are working together with the Graduees team, with Rita and Matt. And since they are really the brains behind it, I let the floor to Rita and Matt, and they can introduce the project.
Thank you so much, Valentina. You've made our lives much easier. And yeah, this has been very much also a collaborative venture. But to very briefly here today and for this presentation specifically, Matt and I, my colleague Matt and I, will be telling you more about this project and the methodologies we have been putting in place to try to identify and prioritize rare diseases for ATMPs, and ATMPs stand for Advanced Therapy Medicinal Products. If you could move to the next slide. So this presentation today is going to be a short duet between Matt and I. But like Valentina said, it's not only Matt and I in ERKReg who are involved in this work. So in addition to Valentina in France representing ERKNet, we also have Giovanni Miliaccio from CVBF. And we are a small team, but I think we have been advancing and working quite well together. And if you could move to the next slide, just to put everyone on the same page and give you just a very brief overview and background information on ATMPs, so these advanced therapy medicinal products, because we know we do tend to use a lot of acronyms that sometimes hinder comprehension. So ATMPs very broadly can be classified into three main types of advanced therapies. We have the gene therapies that use genetic materials to treat, prevent, or potentially cure a disease, and they use vectors, both viral vectors or non-viral vectors, to carry that genetic material and deliver it to the patient's cells. Then we also have cell therapies or cell-based therapies, where we manipulate and edit cells so that they can also have potentially curative or at least therapeutic benefit for patients. And finally, we also have tissue engineered products. So these are cells or tissues that have a scaffold and that can be used to repair, regenerate, or replace human tissue. So these therapies are quite innovative. They hold a lot of promise. They can be potentially curative, and they really can fill a very important and withstanding gap, especially in fields where there is no or there are no treatments, or there are very limited symptomatic management treatments available, which is the case for most rare and ultra-rare diseases. So with that in mind, even though there is a lot of promise, there are also many challenges. And with this project, we really want to streamline ATMP development to make sure that we can accelerate ATMP development and make sure that the ATMPs being developed and the technologies being developed are matched with the most important or priority conditions. But to tell you more about that, I will really leave the floor to Matt.
Thanks, Rita. With Work Package 11, we want to demonstrate how we can apply and scale new novel technological platforms for ATMP development, which will be developed in the Acceleration Hub, which I think is Work Package 21, and how to prioritize rare conditions for those technologies. The ultimate aim is to promote ATMP clinical development by establishing a network of clinical trial sites under this piece of work. We've got 4 key tasks. Me and Rita are busy, and Franz and Valentina and Giovanni at the moment with task 11.1, which is to identify the most urgent and suitable conditions or group of conditions for ATMP development. The second task will be then to see how we can match these technologies with the conditions with greatest need and which would have greatest benefit from an ATMP being developed. And the outcome of that will be then to design a proof of concept study in task 11.3 to pressure test selected platform technologies. And last of all is to assess the readiness of the selected platforms to enter into a clinical trial based on the available data, technological platform, and any calls. So we're going to talk today about task 11.1. Next slide. So we want to try and simplify the procedure for selecting rare conditions with the highest potential for treatment, and match them with the suitable advanced therapies on those technologies based on the best which can be adapted for translation into the clinic. Our first year 1, me and Rita are leading a scope and review and engagement with stakeholders, doing interviews. Rita will talk about that in a bit more detail. Those 2 things are done in parallel, and they'll drawing on the evidence out there and drawing on the experience out there, the insights. We'll then formulate a stakeholder questionnaire to look at how we can develop a prioritization process, and then to turn that into in year 2 a set of criteria or an algorithm which can be used to select conditions which have the highest potential for treatment, etc. And we'll come up with a priority list. Next slide. So the scope and review, this is what I'm mainly focusing on, although we both work together very closely, and there's lots of cross talks which Rita will talk about in a minute. You know, I've used language like highest potential for treatment, greatest unmet need, urgency, efficacy. We can add another one in there about societal impact. All those terms are quite subjective. So what we need to do is we're going to do in the literature review, look at the evidence out there for prioritization frameworks which are currently there, the decision-making matrix involved, how they're used to for drug identification and development, and try and pull together a proposal around what a prioritization process for rare conditions looks like. But when we do that, the other side of the coin is to also look at those ATMP technologies, look at the key characteristics, how they are applied, and what's the treatment targeted, and so we can understand how, and maybe for AVVs, they work for conditions which have an underlying presentation, or the way that the condition works is that there might be some part of the natural body process is interrupted, so accumulation waste products aren't removed. So to understand how the technology works with the condition, and to then sort of see how we can prioritize those conditions and see about the suitability of those therapies to meet them. So we're doing 2 mini reviews, and we'll be exploring those 2 things. I'm just opening up a more detailed document. Where is it? It's here. So the first review will really look at how prioritization processes in rare disease are used, the associated multi-criteria decision analysis frameworks, and the methods for identifying treatment therapeutic targets. We'll pull from that our main findings, and we'll also look at how qualitative evidence is used to decisions are made based on something which is more qualitative, like these areas here. And the second one will really look at identify rare conditions and the characteristics where ATMP technologies have been tested, successful or not, drawing together and clarifying the concepts, the characteristics and the real world applications, so we can come up with a grouping of conditions, because ultimately we want to see whether a technology can be used for a group of conditions, and those are the technologies which we've got there. So I think that covers it. Over to you, Rita.
Thank you, Matt. And so, like Matt already mentioned, we will be combining this evidence from the published literature with the evidence and the experience from a diverse group of stakeholders. So including patient representatives, clinicians, academic researchers, pharma representatives, regulators, and payers. And we will be following or applying these same concepts and principles that we will be really delving into in the scoping review. So the highest potential for treatment, greatest medical unmet need, urgency, efficacy, impact, both on the individual and on society, and technology readiness, so that we can really keep this continuous crosstalk between what we are identifying in the published literature, and use that also to shape and guide the way in which we listen to the community. And it is bidirectional. So we are going to establish some points in time where we are also going to conduct some analysis from, especially in this case, from the semi-structured interviews, and also input back on the scoping review to make sure that we remain complementary. So when we say listen to the community, to this group of diverse stakeholders, we're going to be using 3 tools or methods that we are going to implement, starting with the semi-structured interviews, where we are going to be gathering more in-depth views and experiences from different stakeholders. Here we also want to, in all of these tools and steps, we want always to involve all the relevant stakeholder groups. Then, based on the findings of the literature review combined with the findings of the semi-structured interviews, that is when we predict to have a first a list of potential criteria, and that is going to be the basis of our online questionnaire. And we are going to be sending that out to wider group of people. So keeping the representation of the different stakeholders. But as you might understand, with interviews, we can only listen to a smaller group. So we are hoping to interview 30 different people, organizations, but then with the online questionnaire, we can really reach out to a bigger group. So we would be combining the power of detail and stories, and then with the power of big numbers. So more quantitative and qualitative information. And finally, after we analyze the data of from the online questionnaire, we will be holding a multi-stakeholder workshop to pilot test and also fine-tune the prioritization criteria. So to see if there are any criteria that need to be changed, adapted, and also to test it already probably with some conditions to see how the prioritization scores look. And here we really emphasize the need to keep testing it, since it is such an intricate and complex subject. So we really want to take it step by step, and make sure that we keep it evidence-based, experience-based, community-driven, and by making sure that these are the pillars, our methodological pillars, that the end product is going to be not needs-oriented, and that with all of this, we're going to be reducing bias, so that we are going to really end up with the most representative list of prioritization criteria that will lead to higher result reliability, so that people will trust and will identify and see the need of our criteria, the criteria we come up with, and the prioritization strategy we come up with. And hopefully, ultimately, that will lead to more adoption and also better implementation of these resulting criteria, and with the decision matrix that will result in the end from this exercise. So yeah, we are just to say, before I say thank you, we are still at the very early stages of the project. So really, this is just the methodology we have been putting together thus far. So we still don't have any results to share with you, but we will keep you posted and updated when we have more information. So yeah, just to let you know that we are reaching out to you at the very, very early stages of our project. Thank you.
Thank you, Rita, and thank you, Matt. Yes, I think it was a very good overview of what we've planned. And yes, as Rita said, we are really in the beginning. We just really started in January, or yes, and yes. But if you have any comments, any questions regarding to that project, yeah, please feel free to reach out and also just speak up.
Or if you know people who are experts in ATMPs, we should potentially reach out to, so that they can be involved in interviews, the questionnaire, etc.
Exactly. Flavia will go and find ATMP experts for us.
Thank you so much, Flavia.
I just said I was looking forward to find out more. I didn't commit.
Yeah. No, I'm joking, Flavia. Yeah, thank you very much. I think we are at the end of our small webinar. Are there any comments? Final comments? Anyone? Also, any feedback to this format? No?
Maybe everyone is happy now to have the end of the working day.
Yeah, everyone is tired.
Yes.
That's fine.
But yeah, it's maybe good to have something in between the annual meeting to update you. And the next meeting will be then in May, 19th to 21st in Leuven, but also hybrid, where you can get more insights from the ERKNet world. Good then. Have a nice afternoon.
Thank you for listening.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.
Goodbye. Goodbye.